Let's talk about vasomotor symptoms. Vasomotor symptoms are basically hot flashes and night sweats. The mechanism by which this happens is in the brain, and it's not entirely understood in terms of what causes it. You don't just all of a sudden get hot for no reason, although that's exactly what it feels like. Over 70% of women are going to have hot flashes. And one thing that may surprise you about them is that they don't stop after menopause. In fact, your worst vasomotor symptoms can actually occur the 4 to 5 years after menopause. So that's kind of a painful reality. Now, what's most important about vasomotor symptoms? It's when you look at the literature, women who have more severe vasomotor symptoms actually go on to have higher risk of chronic disease processes and all-cause mortality. Now, what does that mean? It means that the things that your mother, your grandmother, your family members, friends, colleagues, etc., you've seen suffer from. Things like dementia, high blood pressure and heart disease, cardiometabolic syndrome, which can include things like diabetes, even chronic pain. You're more likely to have those things happen. Totally not fair, I know, but if you go through that estrogen suppression or deprivation, and let me stop there and explain that for a second. Estrogen suppression is different than deprivation, meaning when you go through that, which is like normal perimenopause, right, to menopause to postmenopause, could be estrogen deprivation, which you don't have to suffer from. That's the whole point of this video. Or estrogen suppression. Let's just say you're going through, you're taking some kind of medication. It could be something like tamoxifen for breast cancer, or a birth control pill, etc., that's trying to suppress your body's own production of hormones and control that, usually in a synthetic way. When that happens, you can have vasomotor symptoms, where the temperature controls of the brain essentially, or in the brain, not to get too nerdy, but it happens in the hypothalamus. Your sensitivity for being able to control temperature kind of decreases. So if you have that estrogen-driven suppression or deprivation situation where you don't have that thermoregulation or temperature control, the hypothalamus then picks up on that and then goes on to say, oh, well, no, we need to actually create a sympathetic response. So let's control temperature. So release the gates on sweating, right? So you're sitting there doing absolutely nothing. The perceived change happens, and then you just break out into this massive sweat, and all of a sudden, you're hot. The exact mechanism of that is not well understood, but the point of it is, if there's a symptom to treat of menopause, this would be the one. It is also responsible for a lot of quality of life changes. So why is it associated with such poor outcomes in your long-term health? Well, what if your sleep is interrupted, right? If you are waking up in the middle of the night, absolutely drenched and needing to change clothes, then you're not getting sleep. If you're not getting sleep, what's happening in the brain, right? We know one of the things that happens in the brain, that is why sleep is required. You can't just veg out on the TV every night for 8 hours, because if it was just simply resting and not the unique phenomenon that happens during sleep, then you could just never sleep. But we have to have sleep. We spend a third of our lives sleeping. And if, depending on when you go through menopause, if you're 40% of your adult life is spent in this perimenopause to menopause situation, and you're not sleeping well, and your brain is not clearing those beta amyloids and proteins from the brain, what happens? Your risk of neurodegenerative disease goes up. like dementia and Alzheimer's, something nobody wants, right? And I have watched many family members that I loved face an early demise because that wasn't taken care of, among many other things that wasn't taken care of with healthcare. But it's no secret that women's healthcare has kind of been not even pushed to the side. It wasn't even picked up to begin with as something of importance to be put to the side. It's not really been picked up yet. So as we move forward in the future, hopefully this will change. And it is changing. We're seeing it now. So if you're having hot flashes and night sweats, there are many things you can do. And this video is not to like prescribe and tell you exactly what to do, because I wouldn't be able to do that. I would have to know your history, why this is happening to begin with, what all of the lifestyle pieces and parts of that are, and then go on to say, okay, if it's just interrupted sleep, let's look at sleep hygiene. Let's change that. Okay, let's look at some prescriptive things for that. If it's happening during the day and it's, hot flashes during the day, let's look at, there's many mechanisms in order to treat that. The point is, it's successfully treated. I'm on the other side of that already, and that was the first indication that I was going into perimenopause, which mine wasn't really like that. I was surgically induced into that. So it was like trial by fire all of a sudden. And at the point that I was going through that, no one was talking about it. No one was treating it. And it was a horrible experience. The point is, once I educated myself on what to do and how to treat it, they went away 100%. No more issues. Now, does it mean that you're going to need to tweak the integrative functional and lifestyle medicine, which is what I use as a practitioner? Does it mean you're going to need to tweak that occasionally and that your body will respond differently as the years pass? Absolutely, yes. It's why you stay on top of things. How do you stay on top of tracking things? Symptoms, labs, and your lifestyle choices. Okay, and that is the good news. That's the good news to share with you, is that these things can be positively impacted. You can 100% treat these and also improve your longevity, outcomes at the same time. So decrease your risk of heart disease, decrease your risk of neurodegenerative diseases like dementia and Alzheimer's, decrease your risk of insulin resistance and diabetes, decrease your risk of even like stubborn weight gain that you don't want, and that you hadn't changed anything about your diet or your lifestyle, and yet it still happened. All of those things can be addressed. So wherever you are, if you are searching for those solutions, you can go to menopausesociety.org to find a practitioner in your area. Just because you go to that website does not mean they are going to have done the work. Anyone can be listed on that site. However, it's a very good start. People who are on that list should be committed to the process of staying up to date on the evidence base and knowing as much as possible. And then when they don't know the answer, saying, I don't know, let me find that out for you. The last thing you want is to go to a practitioner, and here's some red flags, to go to a practitioner who would say, oh, only this mode of delivery is what I use for hormone replacement. Unfortunately, I think you get that a lot with people who use pellets. So if you go to someone and they are pretty rigid and only want to do pellet delivery, that might be a red flag for you. It is invasive. It is the most expensive way to receive hormone therapy. And it doesn't have to be that way. It does not have to be expensive. It does not have to be difficult to access. It does not have to be painful with an incision and pellets inserted with high doses all at one time. So think of it as being kind of mega dosed all at one time, so that if that dosing isn't right, you're stuck with it for months. Does not mean pellets don't work for everyone. It just means I consider that a yellow flag. And if they only offer that and are pushing you into pellets and saying that's the only way or the best way that it's delivered, that's inaccurate, it's incorrect. That would be a red flag, and I would look for someone different. In terms of what else you can do to address vasomotor symptoms, hot flashes, night sweats, You have to look for how your body is metabolizing estrogen. Now, you probably may have heard of a kind of a misnomer term called estrogen dominance. And many practitioners go, no, it doesn't exist. Well, then they need to explain why, if you take things like an aromatase inhibitor that's natural, or something that inhibits beta-glucuronidase or decreases those levels, if you look at nutraceuticals that manage those things and that improve metabolic processes and support in the liver, why the hot flashes and night sweats go away then. So I don't think that you can ignore the term estrogen dominance. I have a blog about it on garnerpelvichealth.com. I think you do have to pay attention to what is happening with the amount of estrogen that you have. I know that in my case, I'm an N of 1, which means if I was doing a study, it would be just a case study of 1. And a case study of 1 matters, but at the same time, you need randomized controlled trials to confirm that. However, not just talking about myself, but talking about hundreds of women who have gone through that process of paying attention to estrogen dominance. And in paying attention to it and using lifestyle medicine to change it, things like your diet and how you're sleeping and how you're managing stress, it gets better. Those things get better. Also, using things like cognitive behavioral therapy, which can be delivered through yoga, mindfulness, and meditation, those also are supported in the literature to decrease and help manage vasomotor symptoms. Is it the cure-all? Can you just do CBT? No, you can't just do CBT. You're going to have to do something to help metabolize the estrogen that your body does have, and or also eventually replace that, if that's right for you, and it's something that you have to talk about with your doc and your practitioner. So who are the practitioners who can be menopause literate to help you? I do that. I'm a pelvic PT, board certified in lifestyle medicine, et cetera, blah, blah, blah. I've spent a lot of years and time doing training, trying to understand, trying to learn more, keeping an open mind, and watching what happens when I help my patients through this process. And I can tell you that as important as hormone therapy is in treating vasomotor symptoms, you have to also treat the lifestyle pieces of that too. And so as a pelvic health practitioner, that's what I do all day long. Who else can help you with that? Physician assistants, nurse practitioners, MDs, DOs in general. That's who's going to be able to help you. Pelvic OTs may also be committed to the process of learning about menopause literacy and be able to help you with that. Who will not be able to help you with managing your vasomotor symptoms? Just because someone is a GYN, I'm taking the OB part out of it, because really we should probably consider separating OB and GYN, and we should also consider separating and not burdening an OB/GYN with delivering babies, taking care of women across the lifespan, and doing surgery. Those things should all be separated out, in my opinion. But back to the GYN side of things. Just because someone has trained as a GYN does not mean they're going to have any experience in menopause at all, because it's not included in medical school education. Furthermore, in my colleagues, in my generation of Gen X, it was entirely excluded. So we didn't get any training at all. Everything that we know about menopause has come after, is postdoctoral training. So you have to look for that, and you have to ask. That's why starting at menopaussociety.org is a very good place to start. Don't just rely on your GYN. They may not be menopause literate at all. You may be getting information that is 20 years old, and that is actually harmful and not helpful. That means if you can't depend on a GYN, a general GYN, then you really probably can't rely on your PCP for this as well. Does it mean you don't go to them at all? No. Does it mean that you're responsible for creating menopause literacy for them? No. They may not be interested in treating menopause at all, or perimenopause, but they should know that they don't know, and they should know who to send you to. So if you have any questions, drop them in the comments. Thank you so much for listening. I hope this has been helpful. In terms of you may say, well, what am I supposed to do with vasomotor symptoms? It is a case-by-case situation. I couldn't say, not legally, or practically speaking, would not say, take this, try this, and take that, right? Because it's a case-by-case situation. I don't know what your medical history is, what your family history is, what you're struggling with, what the other things that may be issues for you. Maybe it's pelvic floor dysfunction or whatever. You'd have to go through that litany, that whole list of perimenopausal, menopausal symptoms, pelvic floor, orthopedic stuff, and then your practitioner. And then I would say, this might be the thing for you. So find that practitioner for yourself. If you have questions, drop them in the comments. Share this with someone you care about who's going through this. And know that you don't have to suffer with vasomotor symptoms, and you absolutely 200% should never ignore them. Don't laugh them off. Don't make it part of the cultural joke of women being hot in the kitchen or whatever, or delayering at night and laughing it off because they've got to change clothes in the middle of the night because they are actually soaked with sweat. Not a joke, not funny, something to take serious, and something that you can 100% treat.